Hello, everybody. Thank you for joining us today. I've got a guest today by the name of Dr. Michael Schecter. He's a dentist practicing in Toronto, Ontario, Canada, and I'm really looking forward to hearing some of the information he's going to share with us. Let's get right into it, Michael. Why don't you tell me a little bit about what biological dentistry is?
So, biological dentistry is a phrase that's been coined by dentists that take a more holistic approach that try to do it from a scientific background. So, the whole idea is to respect the impact that what we do in the mouth has on the body, and also respect the impact that the body has on the health of the mouth, but try to do it from a scientific perspective, try to do it from a perspective that's rooted in science. So, that's where it comes from.
Cool. So would it be accurate to say you look at the body holistically?
Yeah, definitely. I mean, my whole premise is to try to minimize invasiveness, minimize toxicity. I'm very careful with materials, but also just try to approach dental problems from a holistic or from a whole body perspective.
Cool. And can you give me an example of how, something unrelated to the mouth might affect the oral health and maybe even vice versa?
Yeah, so listen, I mean, if someone's suffering from chronic inflammation, whether that's a herniated disc in their back or heart disease, diabetes, osteoporosis, any chronic inflammation in the body, and inflammation is going to travel throughout the bloodstream and going to lodge in different areas. So it's very common if someone has, like I said, any of these inflammatory diseases, they will have inflamed gums, gum disease. They'll be more prone to cavities, that sort of thing. And then the flip side is anything we put in the mouth that's toxic will influence the body. So some of the, greater known ones are, mercury toxicity from amalgam fillings, or there's a root canal controversy where some members of the holistic community are concerned that root canals can create a low-lying chronic infection that can then affect other parts of the body. So there's no question in my mind that they're both related very strongly.
Interesting. Yeah, I was definitely going to get to the root canals, but since we're on it right now, I think a lot of people don't really understand exactly what a root canal is and why it may or may not be the right choice for an individual. So can you just explain a little bit about that?
I'll try. The first thing I want to say is it's not a straightforward conversation.
Yeah.
Basically, if you can try to picture a tooth, there's the crown of the tooth. That's what sticks out in the mouth, and then there's the root. That's what's in the bone. And in the root is a canal. That canal is what feeds the tooth with nutrition. It's the cardiovascular system. It's the nerve system. And when that area gets infected or necrotic, it dies. And in order to maintain the tooth, in order to control the infection or help with the pain that can result sometimes, what's commonly performed now is a root canal. So what we do is we clean out that area, flush it with bleach, and then stuff it with a heavy metal-laden rubber material. The concern in the holistic community is that a tooth isn't just one canal with a solid tooth around it, but rather the root itself that surrounds the canal is actually a very hollow structure made up of millions of tubules. If you look at a tooth under an electron microscope, it's not hollow, but it's millions of tubules. And so the bacteria that necessitates this root canal doesn't just sit in the canal itself, but it can travel into the tooth, it can travel into the bone. And so when we just flush the tooth with bleach and then we fill it, we don't necessarily get all of the bacteria. And then there can be this low-lying chronic infection that can persist around the tooth. There was a dentist back in the early 20th century named Weston Price. You're probably familiar with the Weston Price Nutrition Foundation.
Yeah, absolutely.
So he was a dentist, and his primary focus was on dentistry. And I think nowadays he would be coined a holistic dentist. He was maybe like the father of holistic dentistry. And so he did a lot of research on focal infections, which are infections that can arise in one part of the body, but that can affect another part of the body. And the thinking is that this low-lying chronic infection that persists around the tooth can influence the weakest or more susceptible part of the body. The Chinese medical community would identify that as a bacteria kind of traveling along a meridian and then affecting the organ that's affiliated with that tooth meridian. I worked at a dental practice a couple years ago with a elderly holistic dentist who's since retired, and she had compiled some interesting information throughout her years of practice where she noted every patient of hers that came in with cancer had a root canal on the affiliated tooth of that meridian.
Wow.
I'm not for 1 second suggesting that everyone who has a root canal is going to have cancer. Right. I'm not saying that at all. What I'm saying is that there seems to be a correlation between chronic disease and infected tooth.
Well, absolutely. Yeah, that's something I've even seen in my practice. I mean, when I work with clients, one of the things I do is I take all of their symptoms, all of their medical history, and put it in a timeline to see what happens in a sequential way. And I've had a number of clients where a root canal is actually the beginning of the whole cascade of events that leads to them actually ending up in my office. And that's happened a number of times, yeah.
Yes, I mean, the homeopath in me always likes to look at there's a rubric in the homeopathic repertory, which is never well since. And it's always really interesting to help patients work through their chronic disease based on, like, the timeline like you're describing. What I do with root canals is, because the first question is someone's going to say, well, I don't want a root canal done, or I want the root canal treated, tooth extracted. And what I always say to people is, it's really important to individualize that decision. The way that I personally do root canals is I fumigate the canals more than once with ozone gas, which eliminates the bacteria. And because it's a gas, it can diffuse. So what I always like to caution my patients against is if they don't want a root canal, I really recommend avoiding a bridge, because when you're fabricating a bridge, what I have to do is I have to reduce the adjacent teeth rather significantly. And what I see too often in my patients, I just saw a woman last week where she came in and she had a bridge done because she had a root canal treated tooth extracted 10 years ago, and now there's an abscess on one of the teeth that's supporting the bridge. And I said to her, well, we need to either do a root canal on that tooth or we have to take it out. And she said, but I don't want to do a root canal on that tooth, and I don't want to take it out. I already am missing a tooth beside it. And I said, I understand. There's not much I can do. So, the focus is always on prevention, trying to, use early warning technology to get at decay before it becomes a problem. But unfortunately, once it gets to the point where a tooth needs a root canal, there's not much we can do other than do it or take it out.
Right. I mean, it all goes back to prevention, right? So what can people do to actually prevent a root canal?
So it's a great question. It kind of depends on how far along you are. Uh-huh. So from a practical perspective, if there's very deep decay in the tooth, and the tooth arguably may need a root canal, the only thing you can do is go to your dentist and have the filling done, and hope for the best, so to speak. The sooner you get it done, the better chance you have of avoiding the root canal. What I do in my practice is if it's very deep or close to the nerve, I ozonate it, I leave a little cotton with ozone, and then I place a temporary filling with the hope that the ozone will neutralize the bacteria and avoid the root canal. If the tooth isn't necrotic, if the tooth hasn't died, then the ozone will actually kill the remaining bit of bacteria and we can save the tooth. I have pretty good success with that, and then I rely on homeopathic remedies to help stimulate the nerve to heal, to help reduce the inflammation. There's nothing in modern dentistry that we can do to help prevent root canals. Taking a step further back, we've developed this really neat program in our office where we have this new machine called the Canary machine. So the Canary machine is an early cavity detecting machine without the use of radiation.
Wow.
So, it's amazing. It's new. It just got FDA approval. I'm really excited about it. I think it's going to change the way I practice. So basically what I do is it works on thermography and light refraction, but what I can do is I can shine a laser on the individual surfaces of teeth and get a reading. So as a patient, you'll get a printout where each tooth will have a number beside it, which will let you know the level of decay. Mm-hmm. So if a tooth needs a filling, it needs a filling. If a tooth is great, it's fantastic. If the tooth is on the road to needing decay or in that in-between zone, we can develop a preventive package, and then we can follow up in 3 months, 6 months, a year, depending on what we feel is necessary. So the underlying foundation of any preventive package starts with nutrition. You can probably talk about this a little bit better than I can, but from an oral perspective or from a mouth perspective, I'm big on pH balance. So if our system is more acidic, our saliva will be more acidic, and we won't be able to buffer the acidity of the food as well as we should be able to. If our system is more acidic, then our teeth and our bones are being drained of those essential minerals we need to buffer bacteria. If our system is more acidic, then the climate or the environment underneath the gums is more acidic, which will allow for more unhealthy microbes such as candida and parasites and all that stuff to live. So the foundation for me is always with ideal diet, ideal acid alkaline diet. A couple little tricks that you can do in the mouth is if you anytime you have sugar, it's an acidic attack on the teeth. So I would rather you take all of the sugar you're going to eat in a week, and I'd rather you eat it once as opposed to eat a little bit every day. Mm-hmm. I also think it's important to give your body a chance to buffer the acidic attack. So if you're snacking all day, or if you're sipping slowly on a juice for a couple hours, it's just this chronic, constant sugar attack on your teeth. I'll give you the example with coffee. I'm not a coffee drinker. I'm not a proponent of drinking coffee, but if one was to have a coffee from a tooth perspective, I would rather you do a shot of espresso, rinse your mouth with baking soda, and live your life, as opposed to sipping slowly on your double-double throughout the morning. Right. That just coats the teeth with sugar and acid, and, you just don't have a hope. I know that a lot of people like to do, green juices or even like a fresh lemon water in the morning to start their day as an alkalining boost in the morning. I think that's great for the system. It wreaks havoc on the mouth because, again, it's a local acidic attack, even if it's alkalining in the body. So my recommendation is if you do something like that, rinse afterwards with something alkaline like baking soda, or maybe even just have a piece of avocado, something that's alkalining in the mouth, and then wait half an hour before brushing, because if you brush right away after an acidic attack, you're wearing away the strongest layer of enamel, which is the outer layer of enamel. So, just to kind of go back, diet is the obvious choice in terms of maintaining health, and I think that all of the other things that go along with life balance are critical, from stress relief to adequate sun, sleep, exercise, water. From my perspective, any time we're off balance, we're more acidic, we're more inflamed. So if we're not sleeping enough, we're producing too much cortisol, we're going to become more acidic, we're going to have that chronic inflammation. If we're stressed, same story. Vitamin D is a very hot topic these days, but the reality is that if we're not getting enough sun, we're just not able to develop the strong immune system and the strong bones and teeth we need to combat bacteria, cavities, gum disease, all that sort of stuff. From a dental preventive perspective, I rely heavily on ozone and iodine to keep cavities at bay. So,
interesting.
I kind of try to explain to my patients that, whatever the dentist does, what we're doing is we're putting a Band-Aid on the problem. The reason that somebody gets decay is because of the acid-alkaline imbalance that's going on in their body. Yes, brushing and flossing helps, but we're brushing away the plaque that's being developed because of our diet, so to speak. I find that iodine works great. There's an iodine varnish that I've developed, which is just organic coconut oil, organic sunflower oil, and iodine. That's it. And the research shows that if you apply this once every 2 months for 1 minute on the teeth, it helps to cut the rate of decay by 50%.
Wow.
So that's a really great thing, especially for kids. I think it's a no-brainer. And the other product I use a lot is I rely heavily on ozone. Ozone is ozone, like the ozone layer that's up in the atmosphere, and ozone. 1 molecule of ozone is equivalent to 5,000 molecules of chlorine. The ozone molecule has an incredible affinity for inflammation and infection because it's so negatively charged. It gets pulled like a magnet towards the problem, towards the bacteria, and because it's a gas, it can diffuse everywhere. So I use ozone gas a lot of my practice to send people home with it. I can send it home with them in like an olive oil medium. So I use ozone oil to brush my teeth. I make for patients often it's almost like a bleaching tray, and then you can put the ozone oil into the bleaching tray and you can wear it for an hour at night or overnight while you're sleeping. This is especially great for patients with dry mouth, patients that have inflamed gums, patients that get multiple cavities. I think that's an excellent treatment for someone to take home. And to be honest with you, I mean, all this stuff, especially in the dental world, this stuff is really cheap. I mean, prevention is not where dentists make their money. And I always try to encourage my patients, and I encourage all of you listening out there that, the one additional cleaning that is recommended by your dentist, it will pay back in dividends in terms of, one, preventing, gum disease and tooth decay in the future, but also reducing that overall inflammation, because the inflammation that lives under the gums is also a negative pressure or risk factor for other inflammatory diseases in the body.
Interesting. And I just want to back up here for a second to the canary machine that actually detects cavities earlier on. Can you actually reverse a cavity if you catch it that early?
Yeah. Like most processes in the body, tooth decay is a dynamic process. So there's a constant remineralization and demineralization that's going on. The whole idea is to try to tip it back in favor of remineralizing. So obviously there's a tipping point where once it gets that deep, you have to do the filling. But as long as the decay is still in the enamel, in the outer layer of tooth, and it hasn't descended into the dentin, into the inner layer of tooth, you can keep it in that enamel for a long period of time. And so I think we're still at the infancy of discovering these appropriate preventive practices. But I'm seeing in my practice, and it's really new with this machine, but I'm seeing some pretty good success. With this machine, the benefit of the machine is that I can actually track what I'm doing. So you can come in today and I can give you a reading of 30, let's say, and so we want to focus on prevention, and then you can come back 3 months later and I can either get a 35 or I can get a 29, or I can see if you're maintaining the status quo or if you're getting worse or if you're getting better. And it really helps. In all honesty, the biggest improvement a patient can make is if they can alkaline their saliva. I would love to see a saliva alkalinity of around 7.25. I would say most of my patients come in at around 6.25, 6.5. We need to get it higher. Tooth enamel dissolves at a pH of 5.5. And so most foods that we eat have a pH of 5.5 or lower, and we need that alkaline boosting capacity of the saliva to bring the pH back up. So the short answer is yes, you can remineralize. The question is, are patients motivated enough to do the small daily things that will get us to where we need to be?
Right. And on the topic of actually brushing our teeth, I read a study recently which was quite surprising. It was in the Journal of Public Health Dentistry in 1999, and it said that most children ingest a large quantity of the toothpaste that they use to brush their teeth, often containing fluoride. So, I mean, there's kind of two places to look at this. Like, is fluoride really necessary for toothbrushing, which it sounds like it's not based on what you've said? And is there a risk at actually swallowing a lot of the toothpaste that children use?
So it's a really good question. I have to preface my answer by explaining that as a dentist in Canada, there's a limit to what I can say that goes against what the dental college recommends, or what Health Canada recommends. And that's why, as a biological dentist, I refer to the root canal controversy as a controversy, and the fluoride controversy as a controversy. So I think if you look at the research, I think that there are pros and cons to using fluoride. I personally don't use fluoride in my personal life, and my patients in my practice opt not to have fluoride in the office. That being said, it is recommended by Health Canada and by the dental college to use fluoride, as they feel that fluoride helps to prevent decay. So that's kind of my prefacing comment. Most kids' toothpaste don't have fluoride. I'm not 100% sure on the number, but I'm pretty sure that kids under the age of 6 are not supposed to be exposed to fluoride. That number might be a little up or a little down, but somewhere in that range. You're 100% right. Any kid, they suck on their toothbrush and they swallow the toothpaste. And listen, fluoride is one thing we're concerned about, but there's also sodium lauryl sulfate, which is a carcinogenic detergent that's in toothpaste. If you look at Colgate or other brands, triclosan is in a lot of these products now. When I buy dental products now, triclosan is the latest rate, where we have triclosan in this product, and that's supposed to be a selling point. Triclosan is a DDT analog. It is a pesticide. It is illegal to be used on plants or grains grown for human consumption. Because toothpaste is a cosmetic and not a food, they somehow get around it. To me, I would not want a DDT analog put in cement used for a crown in my mouth. I would not want it used in my toothpaste. I mean, that's some pretty scary stuff. So fluoride is an issue, but I think there are also other issues to keep in mind. The whole thing about a toothpaste is you want something that has some antimicrobial activity to it. Maybe you want something that will help to remineralize the enamel a little bit. I don't think that fluoride is the only thing that does that. There are even non-natural toothpaste, something like an X-Pure that has this great calcium mineral, this Novamin material that can remineralize teeth. I'm using right now this toothpaste that I was given on trial from a company in the States. It doesn't have Health Canada approval yet. It's made from this enzyme from chocolate, and it's been shown to grow enamel at 5 times the rate of anything else on the market. It's really interesting.
Wow.
So there's other products that you can use. If you ask me what I would recommend, I would recommend ozone oil, because I think that's the most benign, and it's an amplification of nature's response. Our own white blood cells produce ozone to combat disease. But there's a toothpaste that I carry in the office. It's called the Dental Herb Company. It's made in Florida, and it's been published in dental journals to be as effective or more effective than the mainstream brands on the market. So if someone says, well, what would I recommend? The reason I would recommend that brand, I'm not saying it's better or worse than other brands on the market. It just has research behind it. And, you asked me originally what's a biological dentist. I try to work with whether research has been done. So everything that I'm talking about has research to substantiate it and research to validate it. So I think that's important when you're recommending different products.
Okay, interesting. Yeah. Well, isn't dentistry just like fully loaded with controversial topics? And to just add one more to the list here, and we'll finish up on this, is the idea behind mercury fillings, actually putting a toxic metal into the mouth to use as a filling for the tooth. So I guess my first question here is, are there actually any double-blind placebo-controlled studies or meta-analysis that have proven mercury to be safe?
Have proven mercury safe?
Yeah.
Wow. Not that I know of. I haven't seen anything along those lines. The whole thing behind the mercury controversy is that Health Canada claims that the mercury that is in the fillings is non-organic mercury. And so that mercury is not the harmful mercury that can affect our bodies.
Right.
When you look at the research, especially coming out of countries like Finland and Sweden, it's been shown pretty clearly that the non-organic or inorganic mercury gets converted into organic mercury in our body, and that's the harmful mercury. So if you ask me what I think, which I think you're doing, I would say that mercury is the most toxic and non-radioactive substance known to man. It is released 24 hours a day, 365 days a year off the tooth. There's a really great YouTube video on my website, or you can just find it on YouTube. It's called The Smoking Tooth. Mm-hmm. If you Google The Smoking Tooth, you'll see there's a dentist, David Kennedy, out of San Diego, a great guy, who just literally put up a fluorescent screen and took a tooth with an amalgam filling, a mercury filling in it, and you can see the mercury coming off the tooth. As you elevate the temperature, your mouth is 98.6 degrees, more mercury comes off. And if you rub it as you're chewing or whatnot, more mercury is coming off. If you go to that YouTube video, one of the other videos, or there's always those videos on the side. There's one from the University of Alberta, the University of Calgary, I don't remember which one, where they show how mercury kills brain neurons. And it's done under an electron microscope where you can see the neurons literally being eaten or devoured by the mercury. So, in my opinion, even if it's a question, why are we using this stuff? I don't think it's a question, but even if it is, why compromise ourselves? Why put toxins into our body? I think it's important to evaluate and take a step back whenever we're looking at dental issues that, it's not just about having the perfect tooth. It's about making sure that our bodies are healthy and they're not being compromised what we're doing in the mouth. I think we're fortunate to live in a time where we're starting to ask these questions. We're starting to get some good answers, and we're able to come up with alternative choices and alternative materials that can give us the same level of dental success without the toxins or about the compromises that would have to be made.
That's great. And what is the alternative to mercury?
So there's a couple alternatives. One is a resin or a plastic glass hybrid filling. So that's the tooth-colored filling material that can be used in the mouth. The first question someone's going to say is, well, wait a second, that's plastic, we're afraid of bisphenol A and all that stuff. I totally get that. I totally get that that's a concern. The resin that I use has no bisphenol A in it. It has bis-GMA. So the latest research that's come out has also shown that bis-GMA gets converted into bisphenol A in the body. So my resin is 87% filler, meaning glass. It has the least amount of bis product that's available on the market. Is this perfect? No, but I think it's dramatically better than mercury filling. We're talking about a minuscule amount of plastic that's already been cured in the mouth. Your other alternative is doing a lab-made prosthesis that can then get cemented into the area. So you can make something out of gold, you can make something out of ceramic. Listen, if you ask me what I think is honestly the best material, I would say to you, I think you can make an all ceramic onlay or inlay made in the lab and then cement it into the tooth. The problem is these are expensive. So I make crowns out of that material. I don't tend to do fillings out of them. I think right now the best material is this resin with the least amount of biz product that's available. I'm hoping that new things, continue to come out. But that's why we've invested so much in prevention, and we spend the time with our patients talking about diet and nutrition and preventive measures and proper hygiene, because there's no comparison to your own natural tooth, and anything we're doing after that is a compromise. But there's still levels to that compromise, and there's different decisions that you can make from the bonding material to the filling material. I mean, there's still better and worse, so to speak.
Okay, great. So let's just wrap this up. And I guess my final question is, do you have any final recommendations or comments you want to tell our listeners?
I mean, I think it's important to look at the global picture. Try not to get too nuanced with the details, and recognize that I think in order to really reach that ideal health, it's about gaining balance overall with diet and sleep and sun and exercise and water, and your dental health is important, and I think the material that you use is important. But it's also important not to get too anxious or too neurotic about these small things, and make sure that we also have the relaxed attitude and an optimistic view that allows our minds to be happy and healthy, so to speak.
Yeah, for sure. I totally agree that at the end of the day, it's just looking at the big picture. Everyone's an individual, and all factors have to be considered. So, yeah, where can people find you?
So our phone number is 416-665-1145. Schecterdental.com, SCHECTER dental.com, or my email address is michael@schecterdental.com.
Okay, great. Thank you so much.
Oh, my pleasure. Anytime, Josh.
Okay, great. Take care.